In terms of the stability of the coronavirus, there have been a study a lot in an inanimate environment. Some only survive for less than 5 minutes, but majority of the virus can stay for a period of 5 days. Evidence of infection prevention behaviors. This one studied the infection prevention and control compliance in the healthcare workers across sectional study. The results show that most of the healthcare workers practice very low percentage of the hand hygiene and low percentage of the disinfection of reusable equipment, but in terms of the glove use range from 62% to 89%. In summary, we need to focus on hand washing, although the glove use seems to be good. In terms of guidelines, we have a lot of guidelines. For the community health setting, I would suggest the infection control measures for healthcare acute respiratory disease in community setting. Center for Disease Control focus on patient under investigation in the healthcare facility. And for the World Health Organization, they focus on home care for the patient and clinical management of COVID-19. Now, I would like to focus on the update one in terms of the guideline for the clinical management. Even though they use the term clinical management, it can be applicable in the community setting and even in the community-based setting. Based on the guidelines, there need to be pathways to care for the COVID-19 cases. They suggest to screening all persons at the first point of contact in the healthcare facility. In community setting, community health workers should continue to follow protocol in terms of recognition and treatment of the COVID-19. Usually we have the protocol for the community healthcare workers, for the health volunteers. In Thailand we have the health volunteers to do this kind of work. They work very effectively. We have to implement the infection prevention control measures for the patient with suspected or confirmed COVID-19. That means we have the instruction for the patient what to do. We need to apply standard precaution and contact and droplet precaution. What does it mean? Contact precaution means the healthcare workers need to wear the gloves and gown when do the care for the patient. What does it mean for droplet precaution? The healthcare workers need to wear medical masks and wear the face protection and eye protection. They should use medical masks if working within 1 meter of the patient. They should use eye protection such as face mask. They should do hand hygiene before and after patient contacts. And not just only droplet and contact, we need to do airborne precautions. When we do aerosol generating procedures, that means if we have to do tracheal intubation, they are more likely to get infection from the patient. For the healthcare worker, we need to use a PPE, including glove, long sleeve gown, eye protection, N95. And this one, we recommend against antibiotic therapy or prophylaxis for the patient with mild COVID-19. Recommend patient with mild condition to use symptomatic treatment only, and we should close monitoring of patient with moderate COVID-19. Based on the previous study that I showed you on the first part, antiviral have no use. Also, recommend against the routine use of corticosteroid for the treatment of viral pneumonia. We have to focus on control of and mental health support. In terms of the psychological support, we should use what we call first line intervention. For example, if the patient do not have enough sleep or have a sleeping problems, we suggest do the sleep hygiene advice and do not, instead of using pharmacologic sleep aids. Antihypertensive drug should not routinely be stopped. That means we should continue to use that kind of medication. For the women, with COVID-19 during the pregnancy, we need to be very careful, monitor, and for the pregnant women who are suspected or confirmed COVID-19, they may not require to be hospitalized. Based on the current situation, WHO recommends that mothers with suspected or confirmed COVID-19 should be encouraged to initiate and continue breastfeeding, ensure multidisciplinary collaboration among community workers. Now, this one is my main point for the take-home message for the community setting as well. We have main strategies. The first one, we need to focus on good ventilation and physical distance. Second one, we suggest to use the mask and cover mouth and nose, do hand hygiene, and keep area clean. The first one, we need to have a good ventilation and physical distance. We need to have a good ventilation. Keep a distance at least 1 meter distance. So keep physical distance at least 1 meter away. Secondly, request everyone to wear the mask. Right now, World Health Organization suggests healthcare workers to wear the mask and suggest the people in the community to wear the mask also. There are variety of the masks. This one for medical reason. This one can be used from the people in the community. Mask. Right now, World Health Organization recommend wearing the mask in the community. Third measure, do the hand hygiene. You can use alcohol and use soap to wash your hand. Number 4, laundry, keep the area clean and clean the area. We can use the bleach for the disinfection. We can wash using the washing machine or using by hands. There is no problem. But if to have to wash the laundry by hand, we suggest to wear the rubber glove to prevent the cross infection. Use water and plain soap detergent and disinfect it with bleach for cleaning equipment used by the patient. When we are talking about bleach, we are talking about this kind of disinfectant. This kind of disinfectant have active ingredient we call sodium hypochlorite. It can kill viruses. Usually it contains 6% of sodium hypochlorite, but this concentration is too much high, and that it can discolor of the environment and the surface of the equipment. So we have to do the dilution. Can be used only within 24 hours. After that, the dilution may be not effective at all. Usually for the cleaning the environment to kill the germs, we use percentage of 0.05%. So when we take the bleach with 5% of concentration, how do we do? In order to get the 0.05% dilution, we take 1 part of the bleach combined with 99 parts of cold water. We will get the 0.05 concentration. And be careful, do not splash this kind of solution to your body, your skin, your mouth, your nose and your eyes, because it causes a lot of irritation.